I think this is one of the most common questions. So major number one is pharmaceutical care. This one is a practice in which the practitioner take the responsibility for patients' drug-related needs. Or basically you need to take care of patients and you need to study about diseases and medicines.
I love patient counseling. I love a laboratory, love equipment.
You like when you study care, you don't study about factory. So if you go work in factory, it's a really bit hard. Also the same, if you study in Sci and you want to work in a hospital, it's going to be very difficult. Welcome to PharmaTalk Podcast, brought to you by pharmacy students. Hi, my name is Gun and I will be the moderator for today.
I am Om.
And I'm Nisha.
For this episode, we'll be talking about Pharmaceutical Care and Pharmaceutical Science, which is the two main majors in this faculty. Before we dig in, I want you to know a little bit about these two majors. So major number one is Pharmaceutical Care. This one is a practice in which the practitioner take the responsibility for patients' drug-related needs. Or basically you need to take care of patients and you need to study about diseases and medicines. But in the other field is Pharmaceutical Science, which is the study of drug development, study of drug producing and formulation. So it's going to be basically mainly about science, not really about diseases. I think this is one of the most common questions for people who's just beginning to study study pharmacy is the reason we all choose each major.
Yes. So introduce first. For you, what is it?
For me, I'm currently studying in pharmaceutical care, and also Om.
Pharmaceutical care.
And I'm pharmaceutical science. Yes. So for me, first, I choose this major because I think it depends on what I want to work in the future. I want to work in the company, and if I can choose, the first choice is company. But I can also work in the factory also. When I'm studying in the laboratory, I'm very happy in that time more than sak prawat or the
history taking.
Yeah. So I think I don't like to talk to
patients.
Sometimes is they have the very strong belief. Yes. So
it's hard to persuade them, right?
It's hard to change some belief. Yeah. To make it correct. And what about you?
For me, I love two branches of pharmacy. I love patient counseling. I love a laboratory, love equipment. But the final decision for me have two factors. One, I don't like a factory work.
You don't like factory work?
Yes, work in a small room and have equipment. My mom said that, you are good at communication. Good communication with others. So the final decision is I choose a Pharm Care because communication. Yes.
I want to add something. The reason why we choose, most of our friends choose which major we're gonna learn is from two subjects, from therapy and quality control. I hate I kind of hate therapy, but I think I can do well with quality control.
So for those of you who don't know what is therapy and quality control, so therapy is a subject where you study on how to use medicine on the patients. Yeah. So basically you're going to learn about how to give the patients medicine, but quality control is actually learning how to produce good quality drugs, right?
Yeah.
How to know that if this drug is good or bad. Yeah. So for me personally, I chose pharmaceutical care because I just want to work in hospitals and drugstore. Or maybe if I have the chance, I want to work in CRA, clinical research assistants. Yeah. So basically you do research on in hospital to collect data for the big companies. Yeah, basically, I just hate factories. I dislike factories because I feel like it's so gray. Like, it's so gray and boring, personally. I don't get to talk to anyone. I love to talk.
Yes.
I don't want to be, how do I say, wearing like the plastic suit.
Yes.
And getting hot and wearing masks all day. I'm gonna like, I can't do it.
Yes. I love both therapy and QC, quality control. But I love to communication with author. I don't love to work alone.
So basically, you choose from not the subject but the work, the field of work,
yes,
right?
Yes.
So we were talking about you chose because of the field of work, right?
Yes.
So in each major, what can they work as? What kind of pharmacists can they work as?
In Pharm Care. Pharm Care, you have to work in clinic.
Apart from drugstore, hospitals, CRA, or in like companies, another one that you could work as is you work with the government.
Yes.
Or your like food and
drug administration.
Basically, you need to go down the community, go down the store and check that if they have if they pass the standards or not. Like are they selling
it's
illegal
same
things?
like police.
So it's sort of like drug police. Drug police, store police.
Yes.
That's one of the field you could go work as too. Just apart. So because we usually see like pharmacists as in hospital and drugstore, right? Not other fields.
Yes.
So many people think that you graduate as a pharmacist. So basically you work in hospital, drugstore. Yeah. But there's so many fields. How about Pharmaceutical Sci?
I want to clarify something. Pharmaceutical science is not just in the factory, but we can work in the company too. Like as my dream, I want to be the drug representative that I have said in the last episode. We can choose many kind of work. If you are an like kind of introvert, so you can work in the factory very well because you don't have to talk to many people. So in company, there is not just the drug representative that sell the drug to the hospital or doctors, but there are one kind of pharmacist that my senior told me. They have to read the research and talk to doctor, and they have to read like very fast, and their English is have to be very good. So that one is I think I'm interested in that too.
So basically it's like gathering information and updating like the information about that medicine and then talk to a doctor. Right?
My advisor told me the important role of pharmacist in science is regulatory affair. My advisor is work as RA, regulatory affairs. It's important because drug is special goods that have to register in this country. It's legal.
Basically, you're like law side pharmacist, like pharmacist, like you're the law.
Yes,
law
it's about
law. Like pharmacists have to be like police, like lawyer.
So as we talk, there are so many fields, right, that a pharmacist can work as. Too flexible, so flexible. Like we're like elastic girl, you know, like we could work at any place, anywhere. So if you come into this faculty, one of the things that you will have is flexibility. You can actually work. You can actually work as a pharmacist in the hospital, or you want to go work in the company or in factory. There's so many choices you can make. So don't worry about the job you can work. There's so many of jobs waiting for you to
in Thailand. But I don't know much about other
abroad,
countries.
Right? But in Thailand, there are definitely jobs waiting for you. So I think this is one of the questions that I believe people want to ask is that in the present time, can both majors work in each other's field, and is a license separated in each major?
First of all, I would like to say that many of our teachers study like pharmaceutical care, and then she graduated and she found that I think I want to do it in the factory, and she changed her major to pharmaceutical science and study more.
She owned a factory, right?
Yes, and
she owned a factory.
She is our guest too, but waiting for that episode. And
you'll see her in the later episodes, but we won't tell you which one is it.
She told me that if that time you want to do what you want to do, you just do that.
What your heart says, right? Don't force it.
Yes.
My advisors always told that two branches can switch to each other because we can learn. We can learn Sci, can learn care always. And his friend have many people that switch from
switch
care
sides, right?
to science to care is flexible that you told before.
So basically, in most fields, we can cross branches or
cross.
majors, right? Except like factory and hospitals, right?
Yes.
Hospitals for care and factories
And
for
for
science.
science.
You could actually cross too, but it's going to be very difficult since you like when you study care, you don't study about factory. So if you go work in factory, it's going to be a bit hard. Also the same, if you study in Sci and you want to work in a hospital, it's going to be very difficult because there are complicated cases and you have to talk to patients, which Sci is not really suited for this role.
Yes.
So
And the license.
the license.
The license is in Thailand. It's not separate. It's
Not
the
separate,
same license. Yes.
You guys, you study in Pharmaceutical Sci, right? You study in Pharmaceutical Care.
Yes.
So what is the most important skills that you should have? Let's start with
science.
Curiosity?
And also I think for the have to check very clearly and correctly in the fact.
So
In
be
the
detailed.
Yes, too many details in the factory. If you get the wrong decision, just one step, your drug is gone and money. They cost a lot of money.
The money.
Yeah.
So basically, be wise and cautious. That's the one skill that you really think it's crucial for pharmaceutical science. I see. How are you?
Communication.
Communication skills.
In pharmaceutical care, communication is important because you need to communication with a patient, doctors, and
everyone.
Yes, pharmaceutical care pharmacist should handle with this different.
So basically being flexible, right?
If you have a mistake about dispensing,
It can cost someone life.
yes, dispensing prescription screening. Is people will be harmed.
True.
So that's why the last episode that we talked about OSPI, medication error, is
It's
very
the most important.
Yes.
Because we can cost someone life with just a single mistake.
Yes, that is important role as a hospital pharmacist.
For me personally, I want to add on to what Om said. I agree with you, like the cautious, the wise, and flexibility we have to have. And I think one thing that in pharmaceutical care the skills that we have to have is patience. You have to be really patient with both doctors and the patients. Because you don't know who you're gonna be dealing with and what kind of problems you're gonna have. And if you are impatient, you can lash out something that is bad or can damage other people's feelings and also your credibility or your credits. So patience for me is the key thing in pharmaceutical care. And for the last question, did you guys think you chose the right path? You're laughing.
I'm laughing because at first I'm not sure that I choose the right one. But in our university, we start the first semester after we choose the branch. I choose the right one. Because I like all the subjects in this semester. I think it's very interesting and it's very challenging for me.
Challenging,
yeah.
You feel like you belong here, like it's how to say it's fun. It's
Yeah.
better than studying therapy.
The subject, all of them is calling me like, Nisha, come here. And I was like, that's me. Yeah.
For me, I'm not sure. I always answer I'm not sure because most of my senior always told me that you will realize that you choose wrong or right path when you
Do the internship.
yes
Right.
do the internship
During
because
the year, sixth year.
Yes, in the sixth year because you work as a pharmacist, real pharmacist, not a pharmacy student. You will handle with the real patient, real pharmacist. I think I choose the right path because communications.
Communication skills.
You're very good at communication.
And also you
Yes.
say you don't want to work in a factory.
Yes.
What about you, Gun?
For me, I think I chose the right path because same as always, I love to talk to people. I love to dig deep and understand their pain, their wounds, and their reasons. And I feel like I'm a person who can actually break people's walls easily. I can drop their guard down easily, like by just listening to them and talking to them. I think this is one of my skills, and I really like to do this kind of thing, and I think that's why I think I chose the right path. And also, I want to work in Chiang Mai or anywhere in in Thailand, right? So that's one of the reasons I chose care too. Because if you go to Sci, then most science it's gonna be mostly in Bangkok.
Oh, yes.
And the province around.
Yeah, and my hometown is in Bangkok, so that's why.
That's understandable.
Industrial province.
Yeah, industrial province. Yes, correct. Yeah, I just want to work anywhere. I work here because I live here and I love Chiang Mai. I want to work here.
But Pharm Sci can work in hospital too.
Yes, in hospital too.
It's a future. It's a future.
I think we call it extemporaneous preparation. Like you prepare. Is it? I'm not sure.
Only Pharm Care.
Only Pharm Care can do this.
Only Pharm Care to make extemporaneous.
Okay.
But everyone study about in pharmaceutical technology 1 and 2 about extemporaneous.
Yeah, so extemporaneous is actually like a medicine that we make for specific patients who doesn't have like the commercial products, and also like it's specific dosage.
Yes, specific dosage in children or elderly.
Yeah, that's different, right? It's different.
Yes.
So to sum up, all of us choose the right one. Yes, right.
We think we chose the right one right now, though.
I think
basically it's like Om said, we can't exactly know if we chose the right one or not because we haven't seen the real one yet.
Yes. Or maybe we graduated and we don't do this job anymore.
We want to change job.
Yeah. Maybe you are an entrepreneur.
Who knows, right? Who knows?
Yes.
So right now we're just following what we chose.
Yeah.
Futures always change.
Wow.
Dynamic.
Quote.
It's dynamic thing.
Okay, so the reason we chose this topic is because we believe that many of the students, including pharmacy students and high school students, are hesitating to pick the majors. For the early year pharmacy students, they haven't picked the majors yet, right? And they don't really actually know or have information that what each major can do and what we learn or why do we choose it. And for high school students, we usually only see pharmacists in drugstore and hospitals.
Yes.
Yeah.
And we want to how to expand the view on this occupation. And we hope this podcast will help clarify your decision or make you see what each major is about. And we hope you enjoy this episode. And don't forget to comment down below. And this is it for today. Bye-bye.
Bye-bye.
See you guys.
Don't forget to like,
share,
and subscribe. If you guys have any feedback, you can comment down below or press the Google form in the link in the description. We are happy to receive every feedback because we want to implement it into our podcast.
Yeah, and see you in the next episode on 5th October at 8 p.m.
ครับใครยมก็บูสต์เลยฮะ
Ha! Okay.
อะไรอ่ะสองคนนี้ก็เป็นอะไรเลยนะ
ใช่สิฉันไม่ได้แบบว่าบูทได้ตัวเอง
บูสต์ได้
บูทข้างใน
เราต้องเวอร์เนจีเพื่อนไงเราต้องทำท่าอย่าง
เอา
นี้
เต้นเมลอนไหมล่ะงั้นนะ
เอาไหม
ลุก
ล่ะ
เลย
Don't forget to like
เอาไม่ใช่ subscribe เอาไง
เขา
ใช่
ต้อง
ไหม
เป็น
นะ
เขาต้องเป็นแชร์เนาะ
ใช่ต้องเป็นแชร์
Don't forget to like,
share,
and subscribe. If you guys have any feedback or comments, there's a link, Google form down below. You can press that link and give us feedback. We would welcome all feedback because we want to develop a podcast.
Don't forget to like,
share,
And subscribe. If you guys have any feedback, feel free to press the Google form. Google form.
don't forget to like,
share,
And subscribe. If you guys have any feedback, you can press the Google form link down below.
Can you?